Welcome, everybody. I'm Bill Sappenfield, and I have the pleasure of being the director of the Florida Perinatal Quality Collaborative, and we are really excited about this new initiative this year and what it potentially can mean for moms, babies, and families. Our agenda today, I'm going to give a welcome and just give you a brief challenge. Dr. Cole Greaves is going to talk to us about levels of care, the sort of the pilot project and what levels of care are. Then we're going to have a couple of hospitals actually talk about their experience in applying, and then turn it over to the Joint Commission to give you an overview and again answer all the questions you might have. Now, some might say, why are we doing this and why going for national accreditation? We've been now doing a planning year here, and what we learned is one state did CDC surveys for level of care, and what they figured out is when the hospitals thought the level they were at, and then they finished the survey, 70% of the hospitals had overestimated their ability. And then of those who've done the survey, we've had 2 states, and they've done the survey, and now they're getting ready to do the Joint Commission or some other process. And 50% to 70% of those hospitals still overestimated their capability. The idea behind national accreditation is to make sure that everybody has all the quality components you need to really serve mothers well based off the risk of the mothers, and that you have a really good assessment of what that looks like. And that's our whole hope, is to raise the quality of care for moms up to the levels at which you all want to practice at, and to help you be able to do that. With that brief call and explanation of why, I want to turn it now over to Cole Greaves. Cole is the chair of District 12 for the ACOG. He is also co-chair of a maternal mortality review committee, and familiar with the depths of why we're trying to do this system here. And we're very lucky that he is also our consultant in the planning for this year for levels of maternal care here in Florida. Cole, welcome.
Thanks, Bill. Yeah, thanks for everybody joining us here today. So we felt it important to try to adapt levels of maternal care for the state of Florida to try to improve maternal mortality and morbidity by establishing some sort of basic criteria to further delineate the levels of maternal care being provided within the state. This serves numerous purposes, not the least of which is creating a network for education, consultation, and potential transfer to higher levels of care as and if needed based on the acuity levels of the patients. So we followed the ACOG and SMFM obstetric care consensus guidelines that were established and then kind of reestablished 5 or 6 years ago, and then reestablished in 2019. And the care levels of care are level 1, level 2, level 3, and level 4. And as you'll see on the slide that we have up, level 1 is basic care, level 2 is specialty care, level 3 is considered subspecialty care, and then level 4 is the highest level, the regional perinatal healthcare centers. And one of the things that comes up periodically is this notion of RIPIC centers. The sort of regional perinatal intensive care centers throughout the state, of which there are, I believe, 7. And I just wanted to clarify that not all RIPIC centers necessarily would be level 4 verified, and not all level 4 centers are expected to be RIPIC centers. So there, we did follow again the consensus statement, which is available on both the ACOG and SMFM websites, pretty well to a T, as we develop these levels. And so the sort of misconception that RIPIC centers are automatically level 4 and all level 4s of RIPIC centers is not necessarily true. They have very different definitions in terms of the state. And really these levels, as we look at from level 1 all the way to level 4, it has to do with availability of both subspecialists, human resources, and services provided. And these can include maternal fetal medicine coverage and anesthesia coverage, whether that be on-site or immediately available, or simply having access to those services. It can be availability of an intensive care unit, whether there is one, say, on-site or across the street, associated with the maternity hospital, either within it or as part of the system that houses the maternity center. And then also for, say, your level 4 facilities, availability of additional services such as transplant medicine, cardiac surgery, neurosurgery, these kinds of things. So as we kind of drill down, and as I mentioned, probably rather than reading this slide in particular to all of you, if you want further information about the specifics of each level, these are briefs, but it really is well laid out in the consensus document that was produced by the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine back in August of 2019. And I believe if you don't have copies of that, Betsy and the team can certainly circulate those or provide those for you. And if anyone has any specific questions about the nitty gritty or granular level of the levels, I'm happy to take any questions at any point in time, either as part of this webinar or offline if it's easiest. Do we have the next slide, Bill, there?
As what can go wrong, I'm having issues with my computer. It's not letting me
Advance.
It's not letting me advance. So I'm going to quit sharing, guys, and raise it back up again. Please forgive me.
Sure. Yeah. So again, you know, the reason to really do this is as we've looked at the maternity mortality rates in the state and throughout the country, and we wanted to try to provide a method whereby patients could get the care that they needed based on or matched to their acuity of disease or illness or condition. And also that we were able to verify what services were available in each of our maternity hospitals throughout the state. And not just so that the individual hospitals were aware of the different levels and what was required of each level, but also so each hospital was aware of what was available in their region and throughout the state. Not just for, say, transfer of care if necessary to a higher level, but also as a means to create a network where people could reach out and collaborate on education and perhaps invite speakers to come and give lectures on certain topics of interest. And so as Bill's got up this next slide, in terms of the levels of maternal care designations, the overarching goal, of course, is to reduce maternal morbidity and mortality and make sure, again, that if there are maternal deaths that occur in the state, that they're occurring not because of a lack of resources or the lack of availability of provision of various services. So ideally, we're trying to encourage risk-appropriate care based on the maternal needs, ensuring that consultation and referral are available when high-risk care is truly needed. And also for the outreach training, as I mentioned, certainly opportunities that can be created by the network that's born out of defining these levels. And then also to increase equity in perinatal outcomes overall. And again, and I would say, you know, a lot of questions have come from particularly some of the larger centers in the state over concern about kind of migration of mortality and mortality rates. And as Dr. Sappenfeld reminds us, there's not a single delivering hospital in the state of Florida that has enough deliveries to actually develop an annual mortality rate, since none of us deliver anywhere close to 100,000 deliveries. But in my opinion, as a provider, I mean, if women pass in our state, these would all occur in a level 4 hospital because it means that they had access to the very best care with all of the available resources that verified facility could provide, from, again, neurosurgery, transplant medicine, immediate availability of maternal fetal medicine and anesthesia, et cetera. And so why participate in the Levels of Maternal Care pilot project? It helps the hospital leadership understand and know how their facility compares to the national guidelines produced by the ACOG and SMFM. It potentially identifies gaps and provides some documentation to support the acquisition of needed resources. So if you're a level 2 facility and you come to find that you're missing one component in that level, it gives you what's called ammunition to go to hospital leadership and or foundations and ask for capital acquisition to make sure that you're able to meet the needs of that level. Again, creating the network of hospitals committed to quality, promoting national standards of care to make sure that we're all achieving those quality metrics throughout the state, thereby providing better care to our female patients, our maternal patients, and moving that needle when it comes to maternal mortality. And lastly, designation of levels of care are similar to the NICU levels of care, 1, 2, and 3, and the trauma and 4, and the trauma levels of care. And because it's easy for the public to understand. So as you term yourself a NICU level 3 facility or level 1 trauma center, this would be similar to that same type of designation. So it helps the public know kind of what you've achieved in terms of a high standard, even at level 1 and level 2. Those are still high achieving hospitals for sure. So in terms of the actual application for the levels of maternal care and the pilot project, there are kind of two main steps. One is to complete the FPQC request for LOMC funding. That's what allows the FPQC to assist in the funding for the verification process and the first year of verification. Bill, did you want to go over some of the specifics of this in greater detail?
I'm happy to. Again, this assures that we'll be able to do payment if you get it done in time. Again, we want you to then notify the Joint Commission, and we'll let the Joint Commission knows that you're interested. David Eckenmeyer's on the call, and so is Brian Johnson. They're with the Joint Commission. They're here to help you with your application so that you're not on your own, to help make it easy and as seamless as possible for you to go through the Joint Commission. Again, you can go through the Joint Commission even if you're not Joint Commission accredited. They do this for other accreditations beyond just hospital accreditation. And this is really more of a verification than an accreditation. Again, you can submit your Joint Commission piece online. From there, you have about 90 days in which to get it complete if the Department of Health is going to pay for it through FPQC. And you got about a 30-day notice of when your site visit for the Joint Commission will take place for verification. And both of us will be tracking what you're doing. So we're here trying to make it as easy and simple for all that you do. What we want to do is just take a minute, and regretfully, we just got notification that Nadine Walker is not able to make it today because of an emergency that's come up, but we're very lucky to have Kylie Rollins Perez join us from Mount Sinai, and they've gone through the process. Their application is submitted. And Kylie, I cannot tell you how much we appreciate you taking time to share your experience with this application process.
Hi, everyone. By no means am I an expert at doing any Joint Commission applications. I did very heavily lean on my VP of Quality and Risk to assist in doing the application through Joint Commission. Sorry about that. She's done regularly does applications to Joint Commission. So I was able to sit with her and go through the application process with her page by page, but it was a very, very simple, easy task. A lot of the information in there that was required was hospital information, which was already in there for other Joint Commission surveys we've had. She was currently doing a stroke survey submission as well. So all of the information as far as hospital stuff was already in there, and the information that we had to put in there was very basic information regarding our specific units. So it very, very simple with the guidance of somebody from your quality team. And you're going to find that their site was just, it flowed very easy. And when we had some questions, my quality person has a contact for our account at Joint Commission and was able to send them an email and get some answers back. It was over Christmas, so it did take a little bit, but we got some of the answers back very, very quickly after that holiday break.
Kylie, would you mind sharing what level of care you applied for so they know the complexity of your application?
We applied for level 3. I don't know, and Joint Commission can probably, I know they're on the call and they can probably speak to this better. I don't know that the complexity changed the application process. A lot of information in there was statistic gathering, as far as, you know, how many beds we had, how many deliveries. So a lot of the stuff was just very general questions that most, you know, leaders will know for their specific areas.
We do have a couple of minutes for questions. If you have a question that you don't want the Joint Commission to answer, but you'd like Kylie from a hospital's perspective to answer, you could put your question quickly in chat, or you could go off mute and share your question. We can answer a couple of questions if you have anyone for a hospital is actually filling out the application. Well, we have questions at the end of the time too. So if you don't have them now, we can answer them later. Kylie, hopefully you can stay with us.
I will. Thank you.
Thank you. So with this, I'm going to turn it over to Brian Johnson and David Eckemeyer. And I just want to say the Joint Commission is partners with the FPQC and do this. They've been a very cooperative, very helpful partner, and we've enjoyed this very much as we try to help you all get through this verification process. Thank you, Brian. I'm going to stop sharing.
Thank you. This is Dave. I'm going to start sharing in 1 second. So we'll do the navigating on this. Hopefully it works. All right. Everybody see what we can see?
Yes, sir.
All right. Well, I'm Dave Eichmeyer, the Associate Director. I've actually been working closely with the Florida people for the past few months, and I appreciate Kylie's comments. I'm sorry Nadine wasn't here because I've been working with her all the time on that application. I wanted to hear how she'd, hopefully if she had it all finished, because I know that there was a few delays getting it done. But Brian is going to take over for the next few slides. Just let me know when you want to advance, Brian, and I'll jump back in a few.
Okay, sounds good. Thank you, David, and thank you, Bill and Kylie. Thank you so much for that nice handoff. What I'm going to do, everybody, I'm Brian Johnson, been with the Joint Commission about 6 years. And excuse me, just wanted to walk you through just some of the steps that maybe Kylie had mentioned before and just kind of give you some graphics. We're certainly delighted that you're here. We're going to be working with you all, so don't feel like you're by yourself. That is why we're here. So we're just going to show you a couple of quick little screenshots of the application just to kind of get everybody's anxiety down, maybe about what's really in there and what you need to do. And Kylie did a great job. I'm just going to kind of highlight some of the things she talked about, and then I'm going to turn it over to David to talk about what you can expect kind of on that on-site review as the team comes in and looks at your program. Next slide.
If I can get it to advance. There we go. Okay.
So yeah, so we're just going to go over the application and really kind of give you a peek inside of that. As Kylie mentioned, it is probably a really good idea to work with your quality team at your organization. They've been through this before, you know, whether it's hospital accreditation or maybe they have a stroke certification, pretty standard program at most of your hospitals, so they can be really helpful. So it's really great to make sure you have some contact and familiarization with those folks, because usually they are going to be able to either sit down with you and help you walk through it themselves or give you access to do it. And then you can call myself and David, and we can certainly set up a time to help walk you through all of the tabs that I'll probably show you just a few today. So, and then David's going to follow up with the verification process guy. Go ahead, David. All right, we're going to go to the next slide. So this is our Joint Commission Connect site. What we did was took a couple of screenshots just to kind of show you kind of what you could expect when you see it. And even when you get with your quality team colleagues, they may be able to show you this. So what you're going to notice when you get on the site is you're going to have a couple of tabs, and you can see I've just kind of listed them out kind of one by one here. And at the top left, you're going to see you're at home. Hopefully what you'll notice pretty quickly is that you have a certification tab. That is pretty important. Although this is a verification, it sits within the backbone of our certification on an e-application. So I just wanted to make sure that you guys look for that when you get into your screen. This is just the example. So you're going to click on the certification tab, and then we're going to go to the review process, step 3. And you'll see right there, you can click on the application for certification. So that's what we're going to be looking for when you kind of access this dashboard. Once you do that, this is what you're going to see. You're going to see the e-app dashboard. So e-app is just short for e-application. You'll click on update the application. And this is where Kylie was kind of mentioning. There'll be several tabs, as she mentioned. You'll see below right here at step 5. You'll see that there are several tabs here, but a lot of this information has already been done because your organization may already be accredited with the Joint Commission. If they're not, we can open up an application for you and work with you to get this populated as well. But you'll see right here on this tab 1 and kind of step 5, you're going to click on your organization. So we want to go to the next tab, next slide. I'm sorry. This is going to be really important. As you're thinking about the verification program, we want you to know that you have some flexibility here. And what you're going to be able to do as an organization is you're going to work with your teams, and you can put in your date in which you think you'll be ready for our on-site review. That is what this really is. And so when you put the date in, this will allow you to do this right here on this 4th tab. It'll be the initial review tab. I have it listed as kind of step 6. You can put a date in and you can select it, and you do have the ability to go back and change that date. So that date is flexible depending on your organization's availability. So if you put it in, let's just say for February 2023, and you found that you and your team might need to move that back, at this point, you're already approved by the FQP process, and you have some flexibility here. So just know that this isn't nailed down in stone. It's just the place where we really want you to get an idea of when you want to have us come on site. We would come on site after that date. We would not come on site before that. And again, there's some flexibility in setting this date. All righty, next tab. And I don't want you guys to feel like there's a ton of pressure out here if we're going too fast. We're going to work with you on this. So you're going to have these slides, and we'll have this to kind of work with you. The next thing that you'll really see is your site information tab. And I have it listed here as kind of step 7. This is really where you want the on-site verification or review of your process to go. You're going to find a listing of all of your hospitals. There may be several on your record, but you're going to select this site here. You're going to view and edit this site. This is the site where you would select which one you would like us to come out and do the verification. This gives our reviewers, our review team, exactly the location where they're going to be coming, what's going to be going on at this specific facility, so they can meet you guys there. As you listed, when you go through the application, there could be up to 10 sites listed here. So you want to be sure that you highlight which site that you'd like the maternal levels of care verification to happen. As you can see there, right up under there, right left of the circle at number 9, you can see where this organization had already chosen maternal levels of care verification, and they also is the same location where they had their primary stroke. So that's pretty typical what you'd see there. Once you get to this part, you're going to select that view and edit site, and you're going to go ahead and click there, and we can go on to the next slide. This is the tab, which I think is pretty important. And as Kylie was mentioning, we're going to ask you for some information about your program. And this is where you're going to get a chance to select as an organization the specifics as to what type of verification you're actually applying for, whether that be 1 through 4. And you can just see that level of care. So this is some of the information that we'd like you to probably try to have. You'll have these slides probably afterwards. this is probably the information you would be good for you to go gather prior to going to work with your quality representative or whoever has access to the e-application, and you can gather those facts here. As you can see below, there's units and beds, how many LMD beds that you have, postmortem, triage, and ICU. So standard information there. They want to know program volume, just overall, how many maternity care visits or outpatient visits that you have at that facility on a yearly or annual basis. And then they want to look at how many OR rooms that you have available. So you can print this slide out or look at this slide deck once you receive this from the team. And this would be some information you can kind of go back and gather before you actually sit down and try to complete the application. So this should be very helpful for you. And again, David and I are here to help you walk through this. But again, it'll help you kind of understand what you need. And this is probably the most in-depth information that we need concerning that verification, but we can answer any other questions really with respect to the standards if you need that information prior to filling out the application. All right, next slide. In the application, there is a part of the application which we call the CMIP, and this is really where we're looking for your clinical practice guidelines and your PI plan input. And this is in a different level of the application. You'll go back to your dashboard. It'll give you a little link, as you can see here in this little step 11. You'll click on that where you go back to your dashboard. And once you do this, you'll see this new CMIP piece pop up, and it'll say, hey, do you want to go to CMIP? You'll find it right under your application. When you go there, step 13, 12, and 13, you're going to start your CMIP, and that's basically your quality measures and information process. That's what CMIP stands for. It's right below. And so what you'll see here is what's required to fill out the information for this verification. Again, what we're looking for are your clinical practice guidelines around what are you doing for your levels of maternal levels of care. Many of you probably already are using clinical practice guidelines from ACOG, as we already heard another presenter mention, but you get to choose those clinical practice CPGs or clinical practice guidelines for this. We will need those for this, so you will have to complete tab 2. In there, you're just going to basically put in your clinical practice guidelines, and we're going to ask you where you got those from and if you modified them. And that's really all that's required for this particular verification. You're also going to need your PI plan tab filled out for this one. As you can see, there's some other performance measures and reports and intercycle monitoring. There's a lot of other things that are there. But right in the middle of the screen, this other organization, just using this screenshot as an example, when they're doing their initial certification or verification review, these are the only 2 tabs that would be required for you to fill out prior to us coming on site for your review. So again, very simple. You guys are already doing clinical practice guidelines. And then really, we just want to know, what performance improvement process are you trying to measure? What are you trying to help? What are you trying to improve? What have you noticed about your program? Obviously, this program is designed to help you increase outcomes and improve them around mortalities with infant, mom, and baby. And so this is where you would try to put some of those in, and this is up to you. You would basically put those in, and we'd be looking there for what you want to improve on. And then over time, you would probably hit those metrics. And over time, as you had this certification or verification, you probably want to look at trying to change some of those. But these are some of the things that our reviewers and on-site folks will want to look at when they came in. And so give them a chance to see that prior to getting on site. And then they work with you to walk you through that verification process once they come on to do that process. So we want to go to the next slide, David. So this is the next slide, and David's going to cover kind of what you can expect with respect to that on-site part of the verification. And so I'm going to turn it over to him. Again, guys, we're really happy to be here. I know we went through that pretty quickly. We just wanted to kind of let you know there were some things here. You'll get these slides, and then we are here to work with you. Just wanted to kind of give you a look at what's inside. It's actually not that complicated. But we're again here to kind of walk you through these tabs, and we can sit down and maybe take an hour or so if we need to walk you through each tab to kind of help you through the process. And we've done this several times before. So I'll turn it over to David now, and thank you so much for your time.
Thank you, Brian. Yeah, Brian and I are well versed at guiding people through these applications, so we can set up a call with everybody. And actually, I've been trying with everybody, have done a few with a lot of people already, and just walk you through. And sometimes when you see what's needed for the application, you don't have everything at your fingertips when we're on the phone call, but you can get started, you can save it, you can come back. So it's not a one and done issue. You can always come back and fill in the missing pieces and get it finished. So the next thing that you'll be really looking at is called the verification process guide. And that is a document on the Joint Commission Connect site. So that same site where you're logged in to get access to the application, you'll find this guidebook is there for you to review it. A lot of people have called, well, there's several different guides available for different kinds of programs. Certification people have really referred to this sometimes as their Bible for what actually happens during the review. So whether or not you've applied, this is a good resource to start looking at, because it really just tells you step by step, piece by piece, every piece of the agenda is outlined and described in this document. And it just talks about what do you need to have ready, some suggestions for you, what documents you might want to have at your fingertips during each stage in the on-site visit, and what people we recommend you might want to have available for those same steps. And it has a sample agenda. So it's a great resource that you really need to start accessing, especially after you've applied, as you're getting ready for that on-site visit. This is what you're going to be using to help organize the day or days of the review, so you know you're comfortable and ready to go. Now, one issue about the agendas, you will see sample agendas in here, very, very flexible agendas. If the sample agenda looks like the sample, the agenda that you have might be a little different, because if people aren't available at certain times of the day, we're happy to flip-flop pieces of the agenda. The only things that kind of stay where they are, there's an opening conference and there's a closing conference. Everything else during the day or the 2 days is going to be flexible depending on how it works for your team. So keep that in mind. So again, this is what the Joint Commission Connect site looks like. I'm pointing you to this centered person right here, Certification Account Executive. After you have applied, that account executive is going to be the main contact for you to help you with the scheduling, make sure you're accessing the resources that are available on our Joint Commission Connect site. So in this particular case, there's somebody named Marlene Corso for this particular hospital as a sample, but your account executive will be assigned to you after you've applied. If you have other certifications through us already, it's the same account executive for all of those programs, so they may be familiar with your hospital already. So the next, here is where you're actually finding the verification process guide on the Joint Commission Connect page under the review process tab. You'll click through to get to there's a review process link, and it'll get you a list of different certification and verification documents that you can find. So that's the important one, is look for that 2023 Maternal Levels of Care Verification Process Guide. That is what you're going to need to help guide you and understand what the days of the review will actually look like. Now I'm going to talk a little bit more about the timeline issues and sort of an overall application process steps. So a few of the basic tips to get yourself ready. Who is going to do the application with your hospital? As Brian said, sometimes the quality department wants to control it completely. That's fine, let them. But a lot of times they don't, and they let the clinical team leaders fulfill the application. The key thing here is whoever's going to be finishing the application just need to double check that they have the right access on Joint Commission Connect. There is a step where you can choose read only or full access to the accreditation application. So you just want to make sure it's all listed as full for the certification side. You want to contact Brian or me just in case. We'll double check at the application if it needs to be opened for you or not. If your hospital is not Joint Commission accredited, we definitely will have to make a step to make sure you have access to a Joint Commission site for your hospital, because you may not have one already. I've actually started those in a couple of hospitals that aren't accredited by us. So it may take a day or so to actually get that opened up. And then we'll make sure that the certification side of your Joint Commission Connect site is available to you, because that's also not an automatic step. So we may have 1 or 2 steps to make sure everything's open and ready for you to get started. The most important thing is probably step 3, is to have us walk you through this, and we will share screens. Sometimes it's best if you share your screen, because we can actually tell you what button to click, and then you can see what happens and where the data and information need to go as you work through the different tabs. Now, step 4, that CMIP section, it's really a subsection of the main application. So typically I recommend that you work through the main application, get that demographic data filled in, make sure you're choosing the site of care, the date, things like that, get those done, and then we'll go to the CMIP section. And there are 2 pieces that you have to submit there, and we have templates for both of those. And I'm pretty sure I've sent templates out to just about everybody by this point, but if you don't have them yet, you'll ask and we'll send those out. Basically, what we'll send you is 2 worksheets for how you fill in the clinical practice guidelines, what the questions are for the performance improvement plan document that we're going to ask you to put in. And then you use those worksheets as your working documents, get them all finalized. And then when you're ready to apply, you just have to copy and paste a few things in the right places, and you're done with that. So that CMIP gets submitted as sort of a finalized attachment to the main application. You go back from the main application where you first started, there's a final submit button, which is green, and it says submit application on it. So you know you hit the right button. And then there'll be a confirmation that heads back to you very quickly. And I always recommend that as you're working on the application, if we've been in touch with you, send an email to Brian or to me to say we've submitted the application. We'll just take a quick look, make sure it's actually been done and it's all received correctly. So we have the ability to actually look at what you're doing in live status. So if you're halfway done, we can jump into your application, look at what's going on, give you advice. If you're all the way done and you've submitted it, we can double check that yes, it's been received at this end. The next step after that application is actually received, the account executive is the person who gets it in his or her inbox the next day. And that person is then going to set up a call with you fairly quickly and just walk through everything that you just gave us, kind of verify the information you sent and concluded in the application. And then they will talk about the scheduling process. Essentially, they're the experts on getting the next step done, which is actually getting the dates on the calendar. And so your account executive will be a very important contact person sort of to get to the operationalizing of all of this in the next steps. So some important things to remember. Florida certainly wants you to do this. It's still a verification program, is still a voluntary program. But if I knew that state was paying for a lot of it, I don't know if I'd call it as voluntary as much as absolutely necessary. This is a 3-year cycle. Now, the important thing is the state is going to cover the first year only. What that includes the annual fee and the on-site fee. So it's a pretty big chunk of what you're going to be covering for the 3-year cycle. But your hospital will have a year 2 and year 3 annual fee that'll be billed later on. The decision is completely unrelated to your accreditation status. Like we said earlier, you don't have to be Joint Commission accredited to pursue this verification, and nothing that happens with the verification decision flows through to the accreditation decision. The only exception really to that, and this is true of every certification or every review that we have, if for some reason the on-site visitor, on-site reviewer saw something at the hospital, either in this program or in any place in the hospital that was an immediate threat to life or safety, everything shuts down. We have to call the home office. I've only heard of that happening once in my many years at the Joint Commission. So that's the only time that the verification visit would have any impact at all on accreditation. You get basically either a yes or no decision. Now in the process, we do give you a list of the issues that we found during the on-site visit. So you have 60 days to take care of those issues. If you didn't take care of them at all, if you just ignored them, you would not be verified. But since you've gone through this process, I'm sure you will take your 60 days, you'll address those issues. You'll send something back to the Joint Commission that says, here's what we've done, and you get that verification award at the end of that process. We do have a website called qualitycheck.org, and the end result of all of this is that your hospital will be listed there with this process, with this verification award listed under what the hospital has achieved. If you go look at your hospital now, you may have a few things already. You might be stroke certified, you might have other certifications, and this just gets added to the list. If you're not accredited by us yet, you won't appear on Joint Commission quality check right now, but once this is achieved, your hospital will show up and they'll be showed that you have a maternal level of verification and at what level. So here's some quick timelines. Before any of this really starts with the application, we want you to really look at the standards, make some decisions based on the standards and what's expected in the different levels. It's very important to understand these levels carefully. I've said this to a few people. This is not an aspirational review. You don't want to apply for level 4 because you're shooting for level 4 in the future. You want to apply for level 4 because you have all the pieces in place today. And that's what we're going to do when we come on site. So be very careful about what you're applying for. Make sure it's very realistic. Then there is an application process. You'll tell us what date is appropriate for you. When you're getting into the application, there actually is a contract, a specific contract for the maternal levels of care verification. Even if you have accreditation or certification, that's a new contract that you'll have to go through. So I've sent that out to a lot of people in advance as well, and we can do that so you can get your legal people looking it over real quickly. And then we give you 30 days notice of the actual date. Let's say you gave us a readiness date in March. Sometime in February, we'd be sending you a message that says we can confirm that the date of this review is going to be March, whatever. And that's a confirmation. And once you've received that, can't really change it very easily. If you haven't received that confirmation 30 days in advance, you still have a bit of flexibility on the date. But once that confirmation gets to you, it's very cumbersome. I mean, it's not impossible, but I wouldn't recommend trying to change the date. For the review itself, for level 1 and level 2, it's a 1-day review. For level 3 and level 4, it's a 2-day review. And then, like I said, you have 60 days afterwards to submit something that shows what you've done or are doing to achieve or to make some changes based on the findings that have been identified. Hopefully there will be no findings that are a surprise to you, which is always the best outcome. You may know that there are a couple of issues that you need to work on when we come to visit. And if we just confirm that with you, that's actually a really good review. You know you have a little bit of follow-up work, but you expected that anyway. So you work on whatever those issues are, process improvements, revising policies, revising procedures. You know, it depends on the issues that we found. And you kind of take care of maintaining that over the next 3 years. And then we're coming back if you want us to. It's all a voluntary process unless the state says otherwise down the road. So we'll come back in 3 years around the anniversary date of when you had that review, and then kind of do the process all over again. And you do get a short notice of that recertification visit 3 years down the road. So that's our section. Bill, do you want to take back control?
Yeah, thank you, Brian. Like David, I mean, the key gets to be too is realizing where we are. For the state to pay for procurement purposes, we pay after the site visit's done. The Joint Commission needs time from when your application's completed to be able to arrange those visits. Ideally, they wanted to have your applications completed by this month, if not in early February. So we're part of this webinar is to also say the urgency is there only because you want to have your site visit in time for us to be able to cover your costs and such. So please pay attention to the time now. Now is the time to get started. You can't wait 2 months because we can't guarantee that you'll have a site visit in time. And again, the state will pay once the site visit's done, once we know you're actually doing the verification process, and then we'll cover the first full year and such. The big thing that started out so far, the first people is If you're not used to it, there is a contract. I don't know about contracts in your hospital, but sometimes those can take time. So Dave or Brian, send those out to you early so that you can start the review. It's mainly relates to payment and other pieces. Again, you don't have to pay anything if we're covering it for the first year or more, but it's for them to have documentation of the process. Did you want to say more about the contract, David, Brian, given that's gotten brought up?
One other thing about it is portion of that contract is really a business associates agreement because of the HIPAA requirements. Now we know if you're accredited through us, you have signed something very similar, but so this is a little bit of a duplicate in that issue. But our experts decided that this was also slightly different enough from the existing review processes that a new and revised contract was necessary. If you had access to the previous contracts your hospital signed, if you laid them out side by side, you'd see they're very, very similar. So the legal team should probably know that. I haven't had too many issues with contracts. If you needed some minor revisions to it, you want to get that process going as fast as we can, just to make sure it gets through and gets revised and signed as quickly as possible, so it's not delaying your application.
And just a heads up, you will get a bill as soon as you apply, but you do not need to pay the bill. You'll get a bill even with the verification at the site visit. Again, we will cover those if you get the site visit done. And the Joint Commission knows that you're not going to pay those up front. But we warn you because somebody else in your hospital probably pays the bills and they'll get very anxious. So just realize we pay later. David, Brian, you're going to say something.
Yeah, thanks, Bill. And I just wanted to piggyback off of what David was saying. And I think there was a question about that. And I think it's really around the nomenclature because this is a verification versus a certification. And they thought these two things were distinctive enough that legal wanted to make sure that they changed that language in there. And so, verifications in this particular case is just a little bit different. And legal wanted to make sure that that was covered since the other contract in the application cites a certification. So I hope that makes sense. And, certainly if you need some help going through this with our legal team, we can certainly work with you guys as well in your organizations with that as well if they have any questions. Thank you, Bill.
We have about 10 minutes for questions. And then if you have questions after that, just send us an email at fpqc@usf.edu and we'll answer them. What questions might you have? One just popped up. If you ask for level 3 and once your survey, you meet, let's say level 4, are you granted level 4 or vice versa?
Well, no, because we're asking you to make a determination up front where what you're looking for. We're not going to look at level 4 issues if you're not applying for level 4. So we're not going to accidentally find that you're a level 4, even if you applied at a level 3. So that's why it's very important to look at the levels that ACOG has set out, look very carefully at the Joint Commission standards, how we've translated those into kind of how we review a program, and make sure that you have the pieces in place that's reality of what you have, and you're applying at the right level.
Now, David, the reverse though is true. If you apply as a level 4 and you don't meet a level 4, but you meet level 3, you can get a level 3 verification.
Yes, that would work fine, but you want to be very careful though, because one of the things that can happen is, now it may be less likely between level 2 and level 3, but the review process length is different. So if you applied at level 3, but we find that you're not a level 3, we've just come to do a two-day review that you didn't need to have done because it's a one-day review for level 2. So I just want to stress that it's very important upfront. Look at the standards, look at the level descriptions, look at what's required for them, and apply at the level that you have in place. Like I said, it's not an aspirational review. It's a reality check essentially to see that you really have what you say you have.
And Mary had a good question. If you cannot figure out the difference between a level 1 and 2, please reach out to us. We'll connect you with Brian or David, and they'd be happy to walk through the specifics with you. Nuts and bolts, not just in theory.
Yeah, Bill, I was also going to say, just that consensus document from August 2019, jointly released by ACOG and SMFM, actually does a very nice job in tabular form, kind of explaining, level 2 as level 1 plus, and then it details the specific additional requirements for a level 2, and it does the same for level 3 and level 4. So that really is probably the best initial resource is that document. And if Betsy hasn't, maybe we can send that out or post it to the chat even where they can link out to that.
It's definitely up on our website if you need to get access to it.
Right. And I wanted to introduce myself.
Yes.
Also, I'm Betsy Wood, and I'm the nurse consultant with FPQC. So you'll be working with Dave and Brian with the application, the Joint Commission application. But any questions you have for FPQC, and you might be getting emails from me and phone calls from me, just checking on how you're doing. So I wanted to just introduce myself. And I also have a question. I noticed in the application that it talks about the number of patients with the clinic, the number of clinic visits you have or clinical patients you have. What if a hospital doesn't have an MFM clinic?
You would just not, you put a 0 in there, basically.
You can put a 0 because
Yeah.
you just put 0 and it will accept that.
Yeah, you
Okay.
can't leave it blank, but you have to put something in there.
Okay.
Other questions that people might have?
It's Kim Huber from Winnie Palmer Hospital. We are going for our advanced certification later in the year. Totally two different, correct? If I have any knowledge of, if I'm correct, because, and they won't combine them, correct? So it'll be two separate surveys, the
Right.
advanced perinatal and then levels of care.
Yeah. Advanced perinatal is a different review. It does have some data requirements. It looks at some different components of the process. So it is not quite the same thing. So that is correct. Good question. And if anybody has been certified already by Joint Commission for perinatal care, it looks at a lot of the same issues, but it doesn't cover the issue that the FPQC is looking for. So there would be separate reviews.
Thank you.
Good question, Kim. Other questions or comments? I saw someone in the chat said the timeline is aggressive, and we apologize. We've been promoting this now since about August, and I'm sorry that it's aggressive. Part of it just gets to be figuring out how to do the funding. We have 1 year's worth of funding from the state. We are in discussions with the state about continuing it for additional years, and also owing the state a plan for what that might look like in additional years. So you're at the earlier stages, and we do hope we have funding to continue this. Other questions, comments?
Bill, I just wanted to say too, as I kind of teed up at the intro, and as you peruse this document that I've referenced, it really divides the criteria by quite nicely by capabilities, which are really system requirements, and then healthcare provider requirements, which are more human resource issues. So it allows, I think, a facility to kind of get a snapshot pretty succinctly and determine, what do they have the resources for, both from a human standpoint and from a service provision standpoint. So that's maybe the best way to kind of look at it as you go through and decide, are we at level 1, 2, 3, or 4? But again, it just requires downloading that consensus document, which looks like this. You've probably seen it kind of all over the place, but.
Thanks, Cole. And again, that's up on our website. If you can't find it, just send us an email. We'd be happy to send it to you. It's actually easy. Dr. Google also finds it quite quickly. Other questions, comments? Well, we appreciate you being on the call. We definitely appreciate your interest. Just know that our hearts are to improve the quality of care for moms and babies in every way we can, and we'd like to assist you all in that process. We thank our Joint Commission partners for working with us and being helpful in that process. Again, don't hesitate to reach out. Again, just warning, timeline is short. If you're not sure, can you get things into the timeline? Give us a call. Brian or David would be happy to talk with you. We really want this to work for each and every one of you. Last chance. Go ahead, Brian.
So yeah, maybe I'll ask this just to cue it up for my colleague David. So let's just say, for example, we know we want to get you all certified or verified. David, can you talk a little bit about if an organization is thinking about doing this and going ahead and going through the process with Bill and team, that putting in that certification date or that verification initial date on there, that they still, that is that's good for a year. Could you kind of talk about that? I know we want to get folks kind of certified and get this done. But the actual on-site scheduling part of this versus the payment part of it, those are kind of two separate things.
Yeah, our typical process is when you apply, you have up to a year to get the review done, but I know Bill doesn't want you to take that long. So Bill, what date would you, what are you pushing the final date of getting this? Is it the end of June or the beginning of June? I'm trying to remember what you
It's
said.
the end of June, as
End of
long
June.
as your site visit is completed by the end of June. But that's not because of us. That's because the funding for the state stops June 30th for us. It ends.
That's
So
right.
we don't
Okay.
have anything to go beyond that at this point in time.
Okay.
So
So-
that's why
so,
we're encouraging people to move. And we've
Yeah,
been
so
trying
our-
to encourage along the way. And I'm sorry if you're new and that we didn't catch you earlier, but we have been trying to promote.
So our normal process, like Brian said, would allow you more time than that, but the state Florida funding process does not. So you want to be sure when you're looking at that readiness date that you ask for a date in the spring of this year, because that's really going to be very important to get us the ability to get you scheduled within that time frame that the state is expecting.
All right. Thank you, guys.
Well, thank you, everybody. We appreciate your time. Again, we're here to help. We're here to answer questions. Please don't hesitate to reach out. Thank you, Betsy. Thank you, Brian. Thank you, David. Thank you, Cole. And we look forward to hearing from people.
Thank you, everybody. Look
Thank
forward to
you,
hearing from
everyone.
you.